Hi friends, I am Dr. Pratap Singh Rathod. I have done MD in Pharmacy Medicine. In this video, we will discuss about artificial insemination and assisted reproductive techniques. Coming to artificial insemination, it is a process of introduction of semen from a husband or a donor by instruments into the vagina or uterus of a female to bring about pregnancy which is not attainable by sexual intercourse. There are various indications for same and we'll discuss in next slides. So artificial insemination based on where the semen is introduced, it can be intravaginal insemination where semen is introduced into the vagina. It can be intracervical where it is introduced in cervix. It can be intratubular insemination where it is introduced to fallopian tube, or it can be intrauterine insemination where it is introduced to uterine cavity of the recipient. Intrauterine insemination is the most commonly used method and it has a highest success rate. In intravaginal insemination has a lower success rate and intratubular insemination is more invasive and greater risk of infections. Based on whom the semen is obtained, it can be artificial insemination homologous or husband if the semen is obtained of the husband himself. If it is obtained from donor, it is called as artificial insemination donor. And if it is a pooled insemination, where it is artificial insemination homologous donor, in this there is a pooled donor semen in which semen from husband and has been added with the donors. So both the husband and donor's semen is mixed and introduced into the vagina or tube. So this is in this condition there is technical possibility of husband being the father of the child. Coming to indications where artificial insemination is done. First of all, when the husband is impotent. So if the person is unable to have sexual intercourse because he is impotent, but he has viable sperms and is fertile, then it can be useful. When the husband's sperm count is not up to optimal level of fertility, so he has sperms but they are not enough count or their motility is very diminished in that conditions. When the husband is suffering from some congenital anomalies like epispadiasis where the urethral opening is on the top of the penis, or it is hypospadias if it is below the penis, where because of that he is unable to deposit the semen in the vagina. Where there is RH incompatibility between the husband and wife. In case of RH incompatibility also, this is becomes difficult if the child becomes O positive or negative blood groups. In that cases, there is chances that the child may suffer because of that. Then to avoid transmission of some hereditary diseases from husband or from the mother's cases, in that cases, in case of nullity of marriages where marriage can be nullified because of that, in that case also artificial insemination can be done. So in nullity of marriage here, it may be because of where the couples are underage, where other party is already married and again marriage again once more. When one party is unsound mind or mental defective, or when the marriage is not consummated due to because of impotency or willful refusal from wife, or when the woman is pregnant by another man at the time of marriage, in that cases nullity of marriage is applicable. This is also one of the indications for artificial insemination. Coming to procedure, in these cases, semen is obtained usually by masturbation after weeks of abstinence. 1 ml of semen is introduced using a sterile needle into the internal os in case of intracervical insemination at the time of ovulation, that is usually at the 14th day of after menstruation. The semen which is implanted should be implanted. It is first washed using concentrated Ham's F10 solution, which is warm to 37 degrees centigrades. The washing process removes any unwanted immotile sperms as well as it removes mucous and non-motile sperms, which is helpful for increasing the chances of fertilization. Precautions which has to be taken before use of artificial insemination donor. So before using donor semen, some precaution has to be taken by the doctors who does the insemination. In case of if it is obtained from homologous or from that is husband himself, it can be done without any reason. But if the donor semen is used, there have precaution has to be taken. Like the concern of donor has to be taken that his semen is used for insemination of other people, and his wife of the donors is also has to be taken. If the donor is married, then his wife's consent is also taken that The husband's semen is used for insemination of other couples. Identity of donor must remain secret. Donor must be healthy, should not have any hereditary disease, should not be a relative of the couple. Race and characteristics should be similar. So this has to be first to be clarified whether the race of the donor as well as the couple which whom require insemination has to be same. Donor must be of same blood group and there should not be any alleged incompatibility. Couples should be psychologically fit so that once if they should be willing to accept the child after the child is born, since it is obtained from the donor semen. The mother as well as the husband has to be where they has to psychologically understanding that the child is their own. Husband and wife should give consent of giving an artificial insemination. Witness must be present when doing it, and physical administration of artificial should be avoided. The physician who is doing artificial insemination should avoid delivering the child himself. Usually, single donor semen should not be used for more than 10 individuals, 10 children. So only once donor semen should be used for only for 10 children. Usually wise to use full semen. So it is always useful whenever a donor semen is used, as well as husband semen is also should be used if the husbands have some motile sperms. So that there is a chance that husband may become the father of the child. Medical legal aspects of artificial insemination, sorry. There is a danger of litigation. Doctor may be sued following the birth of a defective child. So if there is a chance that the child may have some defective, then the doctor may be sued, claiming that he has not screened the donor properly. To avoid this, the doctor must screen for any genetic disease in case of donors. There may be chance of nullity of marriage and divorce. Since artificial insemination is not a ground for divorce, if it is done for sterility, becomes a divorce only. It becomes a ground for divorce only if it is done for impotency. If the husband is impotent, then the wife can get divorce after getting insemination. If artificial insemination is done without the consent of the husband, then he can file the divorce and sue the doctor also. Legitimacy. The artificial active process would make no difference in legitimacy in case of artificial immunization of homologous and child would be legitimate child. But in case if artificial insemination of donor, the child will be illegitimate. Since he is a child obtained biologically, the husband, the father is different, biological father is different. The child obtained from artificial insemination donor is illegitimate. To avoid that, the parents has to adopt the child. So they have to adopt the child, then he becomes a legal legitimate child. Adultery. Recipient cannot held guilty for adultery because there is no physical coitus. So either party cannot held responsible. The husband cannot claim that wife has committed adultery. Incest. So incest is a sexual relationship between the close relatives, like from husband daughter, father daughter, or mother son, like that. So there is a chance or risk of incestual relationship. So in the future, the child who is born may have relationship with the the donors' children. So they become brothers and sisters. So incestual relationship may become between the offspring born from artificial insemination is possible. Natural birth status remains legitimate, but the status of the artificial insemination donors is illegitimate. Unmarried woman or widow, they may have child, but the child will be illegitimate. So even the unmarried woman can have a child from artificial insemination, but the child will be illegitimate child. Then psychosocial aspects. The husband may feel humiliated for his deficiency in procreation. If he is impotent, that may become humiliated and may develop some psychiatric problems. Mother may sometimes develop psychiatric problems, may become obsessive to know the identity of the donor. Then if the child have born with a some defect, then the parents may blame the donor and they may try to find the donor through the doctor. If the child sometimes the child may develop mental problems if he comes to know that he is born from the artificial insemination, that his parent is different. Now coming to assisted reproductive techniques. So these are fertility treatment in which gametes, that is sperms and eggs, are manipulated outside the body. So here, these are not are naturally fertilized. So gametes, the sperms or eggs are taken outside the body and manipulated in such a way that they get fertilized in different way, and they are fertilized and it is implanted into the uterus so that they do develop into child. So it is a reproductive technique, assisted technique to improve the chance of fertilization. So there are ICMR has guided certain guidelines, that is code of conduct for doing artificial reproductive techniques. So any clinic, ART clinic has to be get approved from the appropriate accreditation authority. ART clinic is not commercial party and in donor program or surrogacy. This has to be done mainly in case of fertility, infertility of in couples. No ART procedure can be done without the spouse consent. The consent of both husband and wife is required. The sperm donor and surrogate should not be relative or friend of a couple. In case of surrogate mother, which I will discuss in next slide, they should not be relative of the friend, or the semen obtained for in case of artificial insemination should not be of a friend or relative. Sex selection is not permitted. There should only certain genetical screening should be done only for genetic abnormalities. No other screening should be done. The consent of couples for use of embryo is a must. The couple's consent is required. Biological parents must adopt a child born through surrogacy if they are born from assisted reproductive techniques, and there is a chance that the donor's egg, donor's semen is obtained for surrogacy also. In that case also, the child has to be adopted by the biological parents. The sale or transfer of human embryos outside the country is prohibited. So obtaining eggs from the female and selling the embryo to the other country is prohibited. Donor must be screened for HIV, hepatitis B, and C infections. The records have to be maintained regularly, checked and guarded without, so that it should not be tampered. So these are a few code of conduct of doing assisted reproductive techniques. Different AIT procedures are available. One is in vitro fertilization, gamete interfere fallopian transfer, zygote interfere transfer, intercytoplasmic sperm injection, ovum donation, micromanipulation techniques in which the sperm is injected or drilling is done in the ovum and sperm is injected into the egg itself. Coming one by one, in vitro fertilization, it involves control ovarian hyperstimulation, that is, or stimulation of the stimulate the ovaries are stimulated so that egg are obtained. Oocyte is retrieved via transvaginal ultrasonographic guided aspiration. So once the ovaries are stimulated, eggs are obtained, oocytes are obtained. There are fertilization of oocyte with sperm in outside the body. So in a petri dish or some media, the egg oocyte obtained from the mother as well as sperm from the husband is fertilized, and then it is subsequently transferred to the resultant zygote, that is 3 to 5 days or later, into the uterine cavity. It may be done by transfer through ultrasound guidance. So ovum is obtained by ovarian stimulation, sperm, and they are fertilized into the egg. After 3 to 5 days, zygote is formed and which is transferred into the uterine cavity. That is in vitro fertilization. In gamete interference transfer, the this involves ovarian stimulation, egg retrieval, followed by laparoscopically guided transfer of mixture of unfertilized eggs and sperms to fallopian tube. So in this, again, the ovary is stimulated, oocyte is obtained, sperm is obtained, and both are transferred to fallopian tube as a gametes. So they are not fertilized, but they are naturally tried to be fertilized in the fallopian tube of the surrogate mother or the mother itself. So here fertilization takes place inside the female body itself. In zygote interfallopian transfer, eggs are removed after day 1. Fertilized eggs are laparoscopically transferred into the fallopian tube. Immediately after the fertilization, their zygotes are transferred laparoscopically into the fallopian tube rather than the uterus. So here the zygote which is formed, that is 1 day zygote which is transferred into the fallopian tube and not the uterus. The intracytoplasmic sperm injection, it is indicated when the male factor of infertility cases. Here the one sperm is obtained and directly injected into the egg prior to intrauterine transfer of the fertilized eggs. So in the egg, the sperm is injected and fertilization takes place, and it is after which the fertilized egg is implanted into the uterus. In case of ovum donation, ovum is obtained, eggs are obtained from the donors. The donor egg infertilization is done used to patient with poor egg numbers or quality. So if the mother they have poor eggs, then the eggs are obtained from the donors. After using superovulation, the egg donor followed by egg retrieval, eggs are fertilized by sperms of the patient's husband and the embryos are transferred to the patient's uterus. So if the mother has functional uterus but have poor eggs or quality, then the donor's ovum is obtained by superovulation techniques. Eggs are retrieved, then sperm is obtained from the husband and then fertilized either outside or by zygote infant transport, and it is implanted into the mother's uterus. Coming to surrogate mother. So these all assisted techniques can be used on the mother itself, or they can also be useful as a surrogate motherhood. In this, surrogate mother is a woman. By definition, surrogate mother is a woman who carries a child for a couple or single person with the intention of giving the child up once it is born. It's also called as surrogate pregnancy also. So surrogate mother may be baby's biological mother, or she may be implanted with the someone else at fertilized egg. So assisted reproductive techniques can be used on the mother itself, but if there is her uterus is not functional, then it can be done on the person surrogate mother who bears the child. She can be a biological mother if she has functional uterus, if the mother's eggs are not possible, or then if the husband and wife sperms and eggs are viable, they can be fertilized in vitro and can be present in the surrogate mother for the developing of the child. The practice of surrogate motherhood has been commercial. Sometimes it was illegally used as a commercial method. Some couples prefer surrogate motherhood in spite of being infertile, just for sake of maintaining the physical appearances. To avoid that, recently, Surrogacy Regulation Act was passed in 2021, which regulates and promotes surrogacy and prohibits commercial surrogacy. So, no couple can hire a woman by giving her money for surrogacy. It has to be done only in case of infertile couples. So it has to be done only in case of infertile couples, and there has to be couples should be present. Husband and wife should be there for surrogacy. Single parents cannot obtain for surrogacy. And it only allows logistic surrogacies. Logistic surrogacies involves no financial compensation for surrogate mother. So logistic surrogacy is only permitted in which the surrogate mother is not given in financial compensation. Only thing is expenses like medical expenses and insurance coverage is given to the mother. Other than that, no other financial compensation is given to the surrogacy to avoid commercialization of this. Some are references. Thank you.